Okay, I'm just sharing my screen there. Okay, so thank you everyone for joining me today. I'm going to be talking about getting virtual healthcare right. So I'm just going to introduce a little bit about myself before I get going, for those that don't know me. So my name is Claire. I'm a practicing physiotherapist and I run Bespoke Wellbeing, which is a physiotherapy-led company based in London. And pre-COVID, we had 4 central London clinics that we were seeing with MSK, occupational health and medico legal clients. And then outside of that, we were building a national network of occupational health physiotherapists to help deliver Oc Health physio across the UK. And when COVID took hold last March, the clinics rapidly hemorrhaged our patients, everyone cancelled, and very quickly we were like, right, what are we going to do? So we switched over to virtual healthcare fairly rapidly. We pivoted quickly. And because all our centres are in gyms, we really struggled to reopen them. So we actually permanently closed down 3 sites and we have 1 left, which we opened for about 5 weeks last year. Again, it was based in gyms, so it was really limited. And it's been closed again. So essentially, we've given virtual healthcare a really good run. We've never done it before. We were like, goodness, how on earth is this going to work? Is it going to be effective? And we had all the same kind of doubts and dramas that everyone else had. So I'm going to be sharing with you today what we've learned, and what we've learned is transferable in terms of skills, and what has been, a real change to practice. So I just want to go through that with you, because I know some of you have dabbled a bit in it, some want to do more of it, some, are struggling to see how it's going to work. So I want to hopefully show that it does work to some, for a lot of cases, and how to get confident in using it. And aside from Bespoke, I also run Therapists to Me Business, which is a free business support group on Facebook for healthcare practitioners, so therapists, nurses, doctors, whoever you are. So if you're not on there already, I think a lot of you are, then do come along and join. So I'll put in the link when I send through the video afterwards to everyone that signed up, but otherwise just hunt us down on Facebook and request to join. Please answer the questions. So let's get going. So today's session, I'm going to be talking about what is virtual healthcare. So there are a lot of things that could be covered under this. So I'm going to tell you what I'm going to be talking about, and there are things that I'm not going to be talking about, just from my experience and what I have a knowledge base in. Next up, we're going to look at what services can integrate virtual healthcare. Where is it working? Where can it be used? What things you might want to consider if you're setting up virtual healthcare, but also you might be running it but feeling like something's missing, or have you got all the things in place that you need to? We're going to look at making a consultation amazing, because we are all amazing, but how do we make the virtual stuff work really well? We're going to have a look at data, some wider data, but also our data that we've drawn from Bespoke last year. We're going to look at what the customers actually think about virtual services, because this has changed quite a lot in the last year, so consumers and businesses. And importantly, how are we going to sell these services? Because that's a big question on everyone's lips. How on earth are we going to sell something that's so new? And people are unsure about it, and their perceptions are not there yet. So first up, what is virtual healthcare? So I'm talking about telehealth, so telephonic and video. I'm not talking about apps where they touch a body part, you fill in something, goes through an algorithm, spits out an answer. I'm not talking about that. I'm talking about you with your patient or client one-to-one in front of you on the screen or on the phone in a consultation. And there are lots of benefits, and obvious ones to the patients are they can rapidly get in, referred this morning, get in this afternoon. They don't have to take time out from their family or responsibilities, work to attend. So they can do it at home, they can do it in the office, those sorts of things. There's loads of benefits. There's the COVID safety benefits of less transmission at the moment, but there are also benefits to you as the practitioner. So it opens up more doors for you. You can see people across the whole of the UK. You can get staffing from the whole of the UK. You don't need a physio based in London now. You can have a physio based wherever, that you can pick and choose. And there might be benefits to your customers, your funding parties. So whether that your pricing is yours to decide, but if you are making it more affordable for online consultations, then your customer might get a more, might be able to access it when they couldn't afford to come before. Or if you're selling it B2B to a business, then you can say to them, actually we can do it for a more reasonable price. And again, you can access clients all over the country. You don't need to just be in London, for example. There are limitations. My whole team are manual therapists, and we believe in that it will be wrong to say that virtual healthcare can take over everything. It cannot, and I'll show you some data later. There are limitations. If people have language barriers, they're going to struggle. If they don't have good internet connection, they're going to struggle. There are some things you need to put your hands on to assess. So there are some limitations. But out of those two, I truly believe that video is king. Having that observation is so important to be able to see the person, helps you build rapport. You can see where they're actually pointing to. They might be saying it's the back of my shoulder, but they're touching their neck. So it just gives you much more, view on what's going on. And, interestingly, we did catch a couple of mental health crises as well on the video, because we could see the way they were holding themselves. They can't hold eye contact. We were quite concerned about them. And we probably wouldn't have noticed that on a telephone call. I've just popped here about integrated care and blended approaches, because what's happening is a lot of the bigger companies is they're building, it's not just a virtual first approach and, it's not as good. We'll triage you and then we'll try and get you into face-to-face because it's better. They're not saying that anymore. They're saying it's a blended approach. They're different pathways, but they're both really, really good, and they're mixing it. So they might be assessed on video, into the clinic if they need to for a session, back out for rehab on a virtual. So there's this blended approach, and I think it will be here to stay. So what services can we integrate with virtual care? So you need to think about who it is you're seeing, who are your patients, who are your clients, and do they have, those limitations for, say, language barriers, or potentially they're older, they may struggle with some of the tech. What kind of patients are you seeing? And what type of assessments and treatments are you doing? And particularly, around virtual care, if you're, doing physical testing, they're going to need to help you. Your patients are going to need to help you. You're going to have to get them to move around, their feedback to you. You're going to need that help from them. And there may be some things that you think, I just need to be able to do that as a passive test that I need to put my hands on, in which case, it might not lend itself quite so well to virtual if you can't think outside the box of how you could do it differently. But it works well for clients or patients that need rapid access to your care, reassurance and a listening ear. We all know that patients, outcomes of patients and their feedback, it all comes back to the rapport building and felt like they've been actually listened to. And you can do that beautifully over virtual care. Referrals, patients, clients that need advice, heavy on the advice. So whether it's, whiplash, back pain, NICE guidelines, occupational health, fitness to work, it lends itself nicely. Or, treatment for different conditions or injuries that has a lot of evidence behind, evidence-based rehab, that goes really beautifully with virtual care as well. So things you need to consider when you're setting up or you're running and just wondering, have I got everything? And it might sound really silly, but the name is so important. This is a new thing for people. If you start calling it online physio here, virtual care there, remote consultations, they're going to get confused. So just decide what you're going to choose and stick with it and use it in all your materials, so that they're not confused. Make it really, really easy and simple to understand. We did look at traffic generator stuff from Google and what people are searching the most. We also did a poll on LinkedIn, and we in the business group as well. And virtual physiotherapy, for example, was seen to be the best one, seemed to be most popular. But just pick what you think you want to use and just keep it standardized. You're going to have to think about your systems. So how are you going to deliver either your telephone calls or your video calls? Are you going to use Zoom, WhatsApp? Are you going to use an inbuilt system like Clinico, or they do telehealth through PhysiTrack? So you might have a larger system that you can use. Some will have a different price tag, but the ones with the high price tag might save you more admin time, the donkey work, as some call it. So just decide on what you want to use. Think about your length of sessions, and this will fit in with your pricing. So I'm going to stick with physio for a second, because that's what we do. But are you planning on actually rehabbing them there and then with you on the screen, they're on the floor on the mat, you're on the floor on the mat, in which case you might need a longer session? Or is it more assessment-based, review, screen share, show them what you want them to do, okay, off you go? You might have a 20-minute appointment. So it just depends on what you want to deliver in that session. Pricing is a very sensitive subject at the moment, particularly in Physioland. So I'm not going to dwell too much on pricing, but we have benchmarked, and it's typically between £32.50 and £45 per half an hour. Some will be more if you've got clinic overheads to pay for, and you're sitting in a clinic delivering virtual care. You probably want to sit it very close to what you would charge face-to-face. If you're not got the overheads and you're doing high volume work, you might go a little bit lower, up to you. You want to think about your pathway for booking. This is really a benefit of online. You want it as slick and seamless as possible, automated as much as you can, save yourself time, but make it really easy for them to follow. Equipment is where a lot of people get stuck. So of course you need the internet, reliable internet for yourself, your computer ideally, and you can split the screen, or on systems like Clinico, have 2 Clinico tabs open, click the little icon to go into a little square, and then you can type as you go along. So always type, try not to handwrite it, because you're just doubling up on time. You've got to type it out again. A ring light is a good device. So I've got a ring light on now, so I'm just going to turn mine off. Okay. And back on again. It just makes you illuminate a bit and just easier to see. If you have any educational equipment that you want to show them on the screen, so I've got a little Mr. Spine that hangs around, have that handy, so you have to go off searching for it under the bed or wherever. Pen and paper, just in case anything goes wrong. And you might want to have a think about a separate kind of headphones or mic if you're feeling like it's echoing, or your mic or your camera on your system is not great, then you can get external USB ones very easily. Think about what's behind you. I've got a boring white wall today. This isn't actually where I see my consults. I do it in my office normally. But if you want to get on the floor on the mat and rehab them, for example, you need to have space. It needs to be clear for them, to look the part. Information, what to expect. So once they've booked the appointment, send them out either the automated confirmation email, or maybe you're emailing them with a Word doc, but tell them what they're going to expect. We actually had someone turn up to one of our sessions, and he was a roofer at work, and he was on top of the roof, and we were like, we're not doing this on the roof. Could just see the lawsuit coming through. So just what to expect. You need to be somewhere comfortable. You're going to be asked to move around. It's going to be via video. You have to click the link to get on, and let them know how to troubleshoot. If they can't get on, and standardize this, so your team will do the same. What do they do? If they're struggling to get on to help you reduce your DNAs, what are you going to do? So for example, in R1, our team, they're not on 5 minutes in, then the physio will text them off Clinico saying, hey, are you okay? Here's the link again. Are you still able to come? And then we wait until a certain time past the appointment. Okay. If they're really struggling to get on, then we will call them. If they're replying to our texts and we can see they're trying to get on but they're struggling, we'll also try and troubleshoot it, use a different browser, use your phone instead. But if not, we will call them. Consent, we've got a similar, the consent statement's fairly similar, face-to-face or virtual care. And then at the end, we've got, if you're accepting this virtual appointment and you click on the link to join the session, we are taking this as implied consent. It's a bit like someone turning up to your clinic room. They are clicking on the link to come in. And then inside our note template, we will have an extra line for if you want to take a photo or video during the consultation, they've got bruising, for example, you want to take a screenshot and put it in their notes, you just need to get verbal consent. So we have a section in there for that. You might want to look at additional programs. So Clinico, and everyone thinks I work for Clinico, have some kind of, kickback scheme there, but I don't. I just love it. I've not used anything else, but I can't compare, but it's colourful and easy. So I like Clinico. But, a system that helps you generate the telehealth and automates. If you're not using a wider, bigger system, you might want Adobe Sign or something like that to help you get consent forms signed electronically. You might want to use exercise prescription software like PhysiTrack. There are loads out there, and just to help you, makes life a lot easier. And they can't really get it wrong because there's videos and explanations and everything. Managing DNAs and UTAs. So our virtual DNA rate's around 5%. I think it's slightly higher than a face-to-face really. And I think that's because they're still having to almost attend, like we're not calling them, and they have to still click on the link, and people forget. But we try our best to prompt them, as I said. Okay, so making an amazing consultation, because we're all amazing, but how do we make sure that that comes across on virtual? So remember, you are still speaking to a person as if you were face-to-face, and they might not have seen anyone else all day. So yeah, you've got to have your charisma on, smile, be yourself, rapport build, the cat walks past, or who's that? Get his name, oh, I've got a dog, have the pleasantries, it's still there. It doesn't have to be like, oh, we're on a screen, can't do that. So try and get that rapport building from the offset. Explain how the session will run exactly like you would do in a face-to-face, and allow them time to ask questions before you start. So for example, you might say to them, look, the first bit's going to be a bit chatty. I'm going to ask you loads of questions. I already have some information on your referral, but I just need to ask you some more things to clarify. Just let you know, I'm going to be writing as I go along. I'm going to be typing. So if I look down or there's any pauses, I'm just typing as I go. There may be some pauses where I need to do that and catch back up. And then we'll get you to move around. I'm going to ask for your help there to help me just move you into different test positions. Then we'll come back together and we'll talk through what we found, what the diagnosis is, and how we're going to manage it. Okay. And then have you got any questions at this stage? Just ask them. Subjectively, it's exactly the same as your face-to-face. Ensure you get your patient goals, expectations, and their views. Really, really important. I haven't got it there, but obviously the red flags are paramount. You must clear your red flags because you don't want to miss anything, do you? So just make sure and document everything down. Objectively, this is where people get a bit funny. They get a bit stuck and think, well, how do I do that? You're going to have to use your imagination. There's actually, if you're a physio, an MSK physio, King's College Hospital have actually done a whole leaflet on how you can do tests virtually. You can actually just Google it. I found it on Google. If anyone wants it, let me know and I'll share it. But observe on the video, look, what can you see? Range of movement, can you look over one shoulder? How does that feel? Does it feel like you're going the same distance each side? If not, is it stiff? Is it painful? Where is it painful? Show me. Oh, it's that side. Okay. Get their feedback. Patient-led palpation, where does it hurt? Oh, it hurts here. Okay, can you press there for me? How does it feel? What number out of 10? 0, no pain, 10, the worst pain. Can you do that the other side? Is it the same? No, it's different. Okay, get their feedback. Strength testing, you can push walls, you can do sit stands, step tests, push-ups. Get them into special test positions as best you can. Neuro is the one that has limitations, so upper limb pain, tingling or numbness that you're thinking is coming from spinal origins. You can still do like calf raises, get them to help you with sensation testing. If there's any doubt, then refer to face-to-face or other, or to GP, I guess you could do also, but just acknowledge there are some limitations there, so just keep an eye on that one. Function and ergonomic display screen, you are already there in their place of work or the home, so if they have trouble doing something in the house, get them, if they're happy to, get them to show you it. It's perfect, it's a benefit of virtual. Analysis, so coming to the end of that, you're going to just exactly the same, talk them through what you found, reassure them, please, I found no red flags, this is going to get better, it looks absolutely normal, this is what we're going to do, this is going to make it feel better. Planning, advice, reassurance, education, exercises, whether you're screen sharing, just sending them out PhysiTrack, or whether you're going to get down on the ground on your mats and do stuff together, up to you. And always, 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 always end with, do you have any questions, thoughts or concerns? Something similar to that. This will help avoid any complaints. It will make sure that your patient has, really felt listened to and everything that they wanted to get across and had any questions about, they've had the opportunity to do. You don't want them going away thinking, oh, I didn't really feel like I got everything answered because it was virtual. Don't want them to think that. So exactly the same as face-to-face, always end up with that question. And practice the tech in the sessions, you'll get much more confident with them. So reviewing the data, so the first set here is actually PhysiTrack have a really nice overview of a lot of data. So I can send that through when I send the video. But 93% of patients report virtual physio exceeded their expectations. That's incredible. There's definitely a perception issue with consumers about what they're going to get. This is amazing, 93%. 83% found virtual physio is effective for their injury or health condition. Again, amazing, really, really good. And this next set of data is from our own audit that we did last year. So we audited 10% of our patients in 2020. We see 200 to 250 a week. So it's a large sample group. So 72% reported a 70 or more percentage improvement since starting treatment to final session. And 70% or more is where you start talking about self-management and discharge, isn't it? So I'm really super pleased about that. Patient-specific functional scale, 77% were better, significantly better. And the pain scores, PNS, 75% feeling better at end of treatment. So I'm really happy with all this, and the team were really, really happy. It's kind of what we felt, but it was good to get the data out. 69% were managed completely with virtual care. 19% needed to go for face-to-face, and 12% other, like on for mental health or injections, scans, x-rays, whatever. And the average number of sessions is 4.8, which I think is very good. It's not a subpar service. You can still make so much difference and change people's lives. So what do customers think? And this is just my own scope of what I felt with my ear to the ground. So March time came, everyone was flapping about. Corporate entities weren't focusing on staff wellbeing. They were looking at furlough, closing their offices down. Everyone was panicking. The patients, the consumers in the clinics, for example, they wanted to wait, didn't they? I'll just wait. I don't want a virtual appointment. I'll just wait and see. When you open up in a few weeks, I'll come back. Obviously, that didn't really happen for a lot of people. July, August, we started to see interest kind of peak. And there was a bit of an uptake. So people started to go, the corporate sector was going, actually, hang on a minute, we've got all these home workers, for example, we actually need to look a bit more about staff wellbeing. And I think the virtual world was becoming more accepted, not just in healthcare, but like even non-healthcare, Zoom meetings were taking place rather than lunch meetings. Everyone was sort of accepting it more. Fast forward, January, we're getting more data back, aren't we? In healthcare, we're getting patient feedback. We're getting experience, the clinicians are getting experience with virtual care, and we're getting confident, really important. We're getting more confident in it, and it's working nicely. And I've just listed some disciplines there: GPs, consultants, psychology, talking therapies, OH, dietetics, physio, OT, and many more. It's working well. So it's definitely a growing area, and I think we need to be looking at how we're going to work with it. So how do we sell it? This is a big one. There's a big issue with perception. There's a big issue of lack of understanding. My husband still doesn't know what I'm doing when I'm in my office. And we have these passive patients and clients that want a massage or want hands-on. They want to lie on the couch. They don't want to just rely on their exercises. So it's a big shift in the perception there, and the approach that you're going to take. And what you need to ask yourself if you're going to sell it, it comes back to basic selling. Does the virtual care, does it hit the pain point? Does it help the pain point of your client, and will it help them reach their goal? Okay, and how will it transform them? We always talk about transformation statements. Where are you going to take people? So patients often don't really care. When they come to see you, they don't come with you and go, for a physio, for example, they don't come into your clinic with neck pain and go, I want you to move my C6-7 right facet joint. I want you to do 10 minutes of soft tissue massage on my right upper trap. And I want you to take my shoulder, for example. They don't come in and say that. They come in and they say, I want you to fix my shoulder, make my shoulder feel better. I want to be able to play tennis with no pain. They don't really care how you get them, do they, to their goal, to get them pain-free playing tennis, for example. They don't care how you get rid of their pain, just get rid of it. You could acupuncture it, you could just do exercises, you could tape on its own, you could do a mixture. So it's in your kind of expertise of how you're going to do that. And so if you know that virtual care can help that person, it's just done differently, then that's what you need to sell. How are you going to transform them? It doesn't matter if it's virtual, it doesn't matter if it's face-to-face. What matters is you're going to transform their life, and you're going to change their symptoms. You're going to help them hit their goals. So I've just talked a bit about standalone services and blended approaches. So looking at B2B relationships. So even if you don't already do this and you're very consumer-based, you could look into whether you could provide services for businesses. You might get higher volume, but you would probably need to be a bit more price competitive. If you were trying to sell it at the same price as your clinic, that's up to you. Blended approaches, you need to show its value and change perception. So when you maybe say if you're just working with your consumers, your patients in your clinics, you need to keep talking about it and show its value. So they might come in for a couple of face-to-faces, but do you know what? You're doing so well. We just need to do rehab with you now. Like, I'm happy to switch you onto virtual and we'll train you online. Brilliant. You don't have to take time out. It might be a bit cheaper for them. Sell it to them and use your website, your email list and social media to help them with that. And how you sell it, you have to be confident in it. You have to believe in it. It's not a subpar thing. It's not, oh, we'll try our best, see what we can do. If you talk like that, it will not sell. You have to be confident in it and know that it will add value to your patient group and your clients. So this is actually how to sell it is taken from a friend of mine who's a branding expert, and this is around services or things that are new, people don't really understand, and he talks about stages 1, 2, 3. So awareness, consideration and choice. So awareness is your client not knowing your brand or service. So hopefully your client groups are knowing who you are, but they may not know about the virtual side of things if that's something you want to start doing more of. And so you need to express who you are, and you need to build that brand awareness and include virtual care in there. Talk about it. Don't hide it away as this thing that's not so good. It's there and it works. So captivate them, hook them, storytell, give patient feedback, spark their interest, show them, what it's all about. Consideration is the client has little understanding of the virtual care. So show them why it's the right choice. How can it help them? Who is it for? There's loads of conditions that, run off rehab based evidence. So, talk about that, seduce them with the experience. You're going to have to show them a bit behind the scenes. What does PhysioTrack look like? Screenshot Clinico, if that's what you use, with maybe just you and a work colleague, so they can see the tech, like show them behind the scenes of what it's all about. And stage 3 is choice. the client doesn't appreciate that they have a choice. So show them that they've got the option of virtual care. Why is it beneficial? What can it do for them? How will it transform them? Build an understanding of what is available, so the how, when, and where. Okay. So my final thoughts are, virtual healthcare is here to stay. If you could potentially get left behind. A lot of the big healthcare businesses will be doing a blended approach going forwards, because they've probably found some cost savings as well, and their clients are liking it. People's perceptions are changing. So I think it is here to stay. Why not? It works. It isn't about, I wouldn't think about you doing face-to-face or virtual. If I had the choice, we would be doing both, but I had to accept that we're in gyms in our clinic. So at the moment, that's not what we're doing. Don't compare them. They're different things, and they both have value, and they both help your clients reach goals. They both transform lives. So try not to think, is one better than the other? Because it's not healthy. Just think about, this one does this one does this, and promote them like that. Confidence to deliver and promote them. You have to believe in it yourself. If you're sitting here after this talk thinking, I just think it's a load of twaddle, don't sell it. You'll be doing it, what's the word? It won't be doing it justice. Use it as a virtual first approach as part of, any government bodies guidelines, but don't, if you don't really want to have it as a blended approach and really push it forwards, then you're probably not going to be able to sell it anyway. If you're kind of thinking it's a subpar thing, you'll probably be trying to push everyone face to face. So you have to kind of be confident and believe in it. And data. The data, is evolving. We're working with the CSP at the moment, helping them look at how much it costs to deliver virtual healthcare and the outcomes, things like that. So please collect data. So look at your normal outcome measures. So we use the patient-specific functional scale. We use percentage of improvement. We use the pain score, and we're starting to use more work status as well. So at work restrictions, or off work. So collect your same data, compare it to your face-to-face services, and see how they are. I know I said don't compare, but you'll be surprised. It does work. So do gather the data. Okay, so that's all my thoughts, and yeah, I will answer any questions. So if you have any questions and you're watching on the replay, you can always email me. But I would encourage those of you that haven't already, please do come along to the free Facebook group, The Therapist Me in Business. So it's not just for therapists, it's for any healthcare practitioner who wants to run their own business or is running their own business for support and guidance. And they're a super friendly bunch. So we can always continue any conversations over there. But anyway, thank you so much for having me and listening, and have a good rest of the week.